Welcome back. Kimberly, don't we all have those night nurse stories about when we go and rush in the middle of the night to the emergency room and have to wait and...
Yeah, and you're scared and maybe someone's not feeling good. It can be a bad experience.
Yes.
But Mike is at a place this morning that is trying to change all of that. They've got a new concept for an old problem.
All right, we're at Elite Care 24-hour emergency center, and this one is on 281 in Bitters. This is Dr. Longoria. We've all felt the frustrations of going into emergency rooms and having to wait there for hours and get around all that culture and stuff. This is your answer to all this frustration with this new kind of center. Tell us about it.
Elite Care is an emergency department licensed through the state of Texas. It is the answer to the frustration that everyone hears with emergency departments. This is physician-owned, and this is the physician's answer to those frustrations.
Okay, and you start that answer by bringing them into a very nice place. If you look around here, again, you see a very nice facility. And again, this facility is designed to kind of start them in a very frustrating and in a very anxious, anxiety-filled emergency room trip to feel a little better, a little more comfortable. Then you bring them to the triage.
Part of changing the culture of the way we deliver healthcare is to bring them into a nice, comfortable environment, starting with that, and then we bring them into the triage area. Here is where you actually starts looking like a hospital. This is the same equipment you'd see in a regular hospital. You have an EKG machine. Patients come in here, they get triaged and seen by a nurse. From the time they walk in the door to the time they're seeing the nurse is about 2 minutes.
Wow, and that's another biggie. You try to get them in and out as quickly as possible.
That's correct.
That is totally the opposite of what the impression you get in other facilities.
Part of changing the culture is to make it patient-driven.
Okay, so after they're done here, where do we go?
From here we go to the emergency department.
Okay, could you show us that?
Absolutely.
All right, let's go check that out. Okay, we're in the heart of this actual center, and again, this is the actual emergency room area.
Right, this is the emergency department itself. The rooms, it's centered around a central nurses station. There's 9 treatment rooms. They're all built to hospital standards, so the same kind of stuff that you would see in a regular emergency department you'd see in ours.
Yeah, and I like the way it's set up as well. Now, when you have this facility going full throttle here, you've got the nurses and the doctors flying around, and again, you try to make it happen. Again, you're still trying to get this as efficiently done as possible.
Absolutely. Part of the efficiency is to design rooms for special things.
For example?
This is our pediatric room. Again, this is centered around the entire family experience. The pediatric child walks in there, it's got its own heart monitor, but the room is big enough to accommodate the entire family.
Okay, and you can see the pictures on the wall, and again, it's spread out so that a mom and dad can actually spend some time there with their child, because of course they're going to be a little anxious as well. Correct. And then this room is kind of unique too.
This room is our OB room. Basically, any female that comes in with abdominal discomfort, we can bring them in here, check any OB problems, and we have our own ultrasound in there that we can diagnose any kind of pathology that needs to be diagnosed.
Okay, and again, all trying to get it done as efficiently as possible in a more timely manner, and again, reducing that frustration.
Correct. Trying to change the culture of the way it's delivered.
Okay, there's one more section that you want to talk about, and that has to deal with emergency patients that may be coming in on ambulances, and then some of the equipment that you have actually on site here that are, again, going to reduce the time and get the answers that you need as quickly as possible. Let's take a look at that.
Let's go.
All right, so Dr. Longoria, this area here that you brought us to, again, ambulances can bring patients in as well if they're not going to be walking in the front door.
That's correct. This is you would get brought in through here and go straight to the emergency department that we just saw.
Okay, so another way, another avenue, and again, this is a section that also has the ability to do a lot of the things that are normally done in the hospital, normally take a long time. They're done right here.
Part of what we had to have in order to be a licensed facility, we must have our own imaging center in the facility.
So you've got a CAT scan here?
A CAT scan is here.
Show us that. This is great.
So we actually have the CAT scan. It is run by a radiology tech, just like it would be in the hospital. There is in the adjacent suite, there's an X-ray suite. Now these are all JPEG formatted images, so they get electronically sent to the doctor's area as well as to the radiologist off-site. That gives us a report within about 20 minutes.
All right, so this is called Elite Care 24-hour Emergency Center. This one is on 281 in Bitters. If you have more questions, all you have to do is go to elitecareemergency.com. Dr. Longoria, thank you so much. You got a great facility, and we look forward to using it.
Thank you, Mike.
Only when we have to.
Thank you.